MRI-guided radiation is a new development in radiation oncology. It uses machines that instead of using X-rays to line up the patient, it uses an MRI. And we know that the MRI does not only have better visualization of most soft tissues, but also can be used continuously during treatment to make sure that the tumor is in the right place while we deliver the radiation. This can be especially advantageous when we're treating tumors in areas that move while you breathe, such as the lung, the liver, the pancreas, and the kidneys. It is probably not as advantageous when we're looking at tumors that don't move while we breathe, such as in the bones. There is some interest in using this technology for spread of kidney cancer to the brain, especially after an operation, as that you may be able to make sure that the cavity where the tumor was that you might irradiate isn't changing as it heals during the radiation therapy. I don't think finding a center with MRI-guided radiation is necessary for every patient with kidney cancer. However, if it is an option offered at that center, it can be a lot easier to treat lesions, again, in the lung, liver, abdomen, including pancreas, as well as the kidney, as compared to other types of radiation. Pancreatic metastases are a common form of spread of kidney cancer. If they are limited, we can offer surgery to some patients with metastases of kidney cancer to the pancreas. However, in many patients, there can be an area in the pancreas that's not amenable to an easy surgery, or more than one nodule of kidney cancer scattered throughout the pancreas. It's very challenging to deliver the high doses of radiation that are necessary to treat kidney cancer in the pancreas because of the nearby organs like the stomach and intestines. In this situation, MRI-guided radiation has a clear advantage and can be used to safely deliver high doses of radiation to the entire pancreas. When we talk about radiation therapy, often during the radiation treatment themselves, there's not a lot of side effects. But when you talk with your radiation oncologist, there's this discussion of late side effects that are often caused by scar tissue that the radiation can make in the body. Sometimes these late side effects can be pretty severe. If it's scar tissue in the wall of the chest or the belly, this can cause some pain. If it's scar tissue that's there next to an organ internal to the body, it can cause a hole or bleeding, and these things can be pretty scary. These types of side effects often don't show up for many months, if not years, after the radiation is already delivered. When we think about the risk of these side effects versus the risk of the tumor that we're treating, we often worry that the tumor, left uncontrolled, could cause these same problems, and therefore kind of decide on a treatment like radiation that might have a risk of causing these problems later down the line and make sure that the tumor doesn't cause it sooner. The other thing is that if you've had radiation in an area and many months or years later, far after you've seen your radiation doctor, you're noticing something new or different, it's important to ask your primary team if it could be related to the radiation, or reach back out to your radiation doctor to see, is this problem that I'm having a late side effect from radiation? Sometimes the radiation oncologist can give you reassurance that it is from the radiation and not from a new area of cancer or some other problem, as well as ways to manage it.